Hi again. Now that we've talked about general topics that we study in child development and the theoretical approaches to studying those topics, we're going to talk about conducting research with children. More specifically, we're going to consider some factors that limit how we can study infants and children. And we're going to describe, compare, and apply developmental methods and designs and evaluate ethical dilemmas in developmental research. I'm first going to start by talking about limitations when studying infants and children. Now, I want you to note that this information is not in the book, but it is important to know the challenges in studying young children, so that's why I want to go over it. One of those first challenges is infants' motor and visual limitations. So if you look at the slide up in the upper right-hand corner, you can see how blurry infants' vision is. As newborns, they have very poor contrast and poor acuity, poor ability to focus, so things are very blurry. And then over time, their contrast improves and their ability to focus, and faces become less and less blurry across the first year. But just knowing their difficulty in seeing faces and other objects and being aware that the distance you put them at is going to affect whether or not infants can see them is very important if you're testing infants. You also have to think about their motor limitations. Infants are learning to reach and walk and crawl and sit, and so you have to be able to think about, are infants capable of doing certain things that I want to test them in? And if not, how might I be able to overcome that and come up with a design where I can test them? And a lot of our work, we actually use infant looking so that we don't have to rely on their ability to reach or walk or crawl. Another thing you need to think about, though, are language limitations. First off, if you're studying infants and toddlers, you have issues of them being pre-verbal, that they're not speaking yet or speaking very little. And then how much do they understand? Even with young children, what do they understand when you give them directions for a study? And then what are they able to produce? Can they speak well? They might be able to understand pretty well. We usually understand things before we can speak well, but they might not be able to speak as well. So you have to come up with other things, like have the kids, do an activity or point at something or look instead of talking. And it's also good to check with the parents on what their child's vocabulary is, so you kind of get a sense of whether you're using words that they're familiar with. Other things that you need to think about are cognitive limitations of infants and children. There's something known as a perseverance error, where children keep picking the same item over and over. And it seems to be that sometimes they have difficulty inhibiting a previous response. And there's some other reasons why as well, but because they keep picking the same thing, we don't really know if what they're doing is really valid. We have memory issues. You might give a children directions, but then they get focused on the task and forget what they're supposed to be doing, so you have to constantly remind them of what the task is. Very short attention spans. So one of the things we have to do, for example, in our infant research is use an attention getter and keeper, which is typically a moving object on the screen along with sound to get the infant's attention to look toward the screen before we actually show them what we are interested in measuring. And you also just have to think about differences in thinking. We have to remove our biases and realize that children's way of thinking is very different from ours as adults, and to sort of get in that mindset. Other things are just simple things like fussiness and squirminess. A lot of infants and toddlers will get upset and cry and just not be willing to participate. Other times they're just simply off task. They aren't looking where you want them to look, or they're unwilling to start or continue the task. So there's a girl in the PowerPoint who's just sticking out her tongue and being silly, and she just doesn't want to do the study. And that happens in research, and it's just something you learn as you're a developmental psychologist. The last thing to consider are the children's parents. Sometimes parents interact, they mean well, but typically you don't want the parents to interact in the study. Other times, if you want to avoid parental interaction, you might want the child away from the parent, but then the child might have separation anxiety, and that can be a problem. And also, we always need parental consent for any study we do with children. So these are all important things to consider when you do research with children. Okay, so now what I want to do is move on to talking about developmental methods, which is essentially how do we study children, how do we collect data. And one of the ways we can do this is through systematic observations, and there's two different types. The first is naturalistic observations, and this is simply where we're observing children in their natural environment. And it's a great way to start learning about a particular age group or a particular type of development. But some of the limitations is that not everyone has an opportunity to display a particular behavior in everyday life. For example, maybe you're wanting to watch cooperation, but you happen to be observing children while they're supposed to be doing a task on their own. As you can see in the slide, though, there are different images here. So you could observe children playing together. You could observe how young children interact and talk with one another, or you could observe children in a learning setting. And these are all just natural observations where you can study children's development. Another type of observation is more systematic and more structured. And in these types of observations, we have the opportunity for everyone to display the response because we've set it up so that they will display the response. And it's a very efficient method for collecting data, but sometimes it doesn't tell us much about why the response occurred. Maybe this would never happen in the child's actual life because they wouldn't be exposed to it. Now, when you do these types of studies, you can put a lot or a little structure in it. So, for example, in the image in the upper right, there's a little girl reading with her father. And what you could do is, this could be with some structure where you observe parents reading a particular book to a child to examine their gender stereotyping. How much or how little do they just, focus on gender stereotypes in a book? And that's providing some structure with the book, but otherwise giving parents a lot of leeway in what they do. Another thing, though, is you could put a lot more structure. So the image on the bottom is an infant sitting on a parent's lap looking at faces. And this is a lot of like the work we do in my lab. And here we are specifically showing infants certain faces and we're measuring their looking. We include other objects in the laboratory, so there's nothing else for them to look at. So there's a great deal of structure in this setting and not a lot of leeway, but it gives us a good idea of what infants are interested in then based on what we're showing them. Now, other than observations, there's other methods we can use with children. Some of these are self-reports, interviews, or questionnaires. And again, you have to think about verbal abilities, and if verbal abilities are poor, you might need to speak to the child's parent or teacher. But one such interview is the clinical interview, and these are really unstructured, they're flexible, they're conversational. And this type of interview allows the child to discuss their true feelings and thoughts and really speak freely. And so the idea is that you ask the child a question, they respond, and then you follow up with a question based on that response. So it's really kind of going with the child's own ideas and following up with those. And it gives us a great deal of information. But one of the limitations is that there's some concerns about their accuracy because the child might be trying to please the interviewer. They might have difficulty recalling information or putting their ideas into words. And also, if children are giving different responses and you're following up on those different responses, you're going to have a lot of different types of information for each child. So it can be difficult to compare responses across participants. Now, in a structured interview, participants are asked the same questions in the same manner. And so I might have 10 questions, and every single child gets asked those same 10 questions, regardless of what their response is. And so as you can imagine, though, a limitation is that the depth of information you can get from this type of interview is limited. And again, you could also have some accuracy concerns. Children can always be trying to please the interviewer. Okay, so another method I want to talk about are psychophysiological methods. And essentially, these types of methods for studying children have to do with bodily activity and measures of that. So measuring things like the child's heart rate, their respiration, their pupil dilation, stress hormone levels. Very popular today with the onset of technology is measuring brain activity through EEGs or ERPs or fMRIs, and essentially seeing when brain responses occur and in what areas of the brain those responses occur. Now, some of the problems are that we're not always certain what caused the response in these, so it's really important to get a baseline rate of, either the child's heart rate or their brain activity before you show them something or test them on something like depth perception or their mother leaving the room and seeing how their body reacts. You want to get a measure prior to that happening to see exactly what that baseline level is. Okay, and now another way to study children is known as the clinical or the case study method. And this is actually a combination of all the methods we just discussed, but it's for one particular child. So you might actually observe that child in both natural and structured settings. You might be interviewing that child and their parents and or teachers, getting test scores on verbal or mathematical abilities, and collecting psychophysiological measures. And this is an excellent way to learn about a particular child and maybe why they're really gifted or why they might be having difficulties in a particular area. But the limitation is that this might be great for assessing this child, but what you find may not generalize to other children. And so that's always a concern based on what you can learn in a case study. Another way to study children is through something known as ethnography, and this is borrowed from anthropological literature. And this is where you obtain information about a cultural group through observation. And so essentially the researcher goes to a particular culture and really minimizes how much they interact, and their job is solely to observe and learn about what's important, what's valued in that culture. And very important to this is for that research to go and try and remove any preconceived notions or biases that they may have about that cultural group or about what's normal in development ahead of time. Because if not, the limitations are that the researchers might selectively choose what they want to observe and sort of ignore other things, or they might misinterpret what they see. So it's really important to try and remove these biases if possible. And of course that is difficult, but ideal if you can. Okay, so now that we have a sense of how to collect research on children, I want to talk a little bit about designs. And there's different ways of how a study can be designed. And one of these is correlational, and it's simply where you're looking at the relationship between two things. So if you look at the graph on the PowerPoint, the graph shows the difference between boys and girls and the number of words spoken from 16 to 30 months. And from this correlational research, we only know the relationship between age and number of words spoken, and in that it differs for boys and girls. So girls speak more words in general and substantially more at particular ages. But why? It doesn't tell us why this relationship exists. And so maybe this difference is due to differences in boys and girls' behaviors or just maturational rates. Girls tend to be more physically mature than boys. Or it could be the way adults interact with them. So we know this relationship exists in a correlational study, but we don't know what's caused it. And so to maybe try and figure out how it's caused, we can do an experimental study. And we could do something like, well, let's see if adult interactions are important, and we're going to alter the way adults interact with boys and girls, and we're going to see if that impacts word learning. And in this type of investigation, then, we're going to manipulate something known as the independent variable, and in this case, that would be the adult interaction, whether the adult's talking a great deal and interacting a lot or very little. And then we're looking at a particular outcome or measure, which is the dependent variable, and that's the number of words spoken. And we can see then by specifically manipulating interactions what type of effect that has on the words spoken. Now that's a very structured experimental design, and there's more modified ones we can use too, where we actually take advantage of natural settings. And one of these is known as a field experiment. And this is where we assign participants to different treatments within natural settings. So maybe you're interested in the effects of segregation on looking at children's in-group and out-group attitudes. And so Becky Bigler's done a lot of work where she's taken kids and given them different colored t-shirts. And so maybe you put kids in different classrooms in different color t-shirts, or kids at different schools with different color t-shirts. And that's how she would manipulate segregation. All the blue t-shirt kids go to that school, all the yellow t-shirt kids go to that school. And then you can measure what the blue t-shirt kids think about the yellow t-shirt kids and vice versa. Now you can also do a natural experiment, and this is where the different treatments already exist in natural settings. And unfortunately, across the United States, segregation is present in many school settings still to this day. And so you can go look in those settings then where it's primarily Hispanic Latino children versus African American children versus Euro-American children, and see how their in-group and out-group attitudes are based on the segregation. Okay, so we've talked about general research designs, but now I want to talk about developmental research designs. And the reason thinking about development in particular when you're designing a study is that we study change. Developmental psychologists study change. And so how do we study that change? Well, if you're looking at this chart here, we can study something like, say, the development of kids' play from 1 to 5 years of age. And there's at least 3 different developmental designs that I could use to investigate the changes in development. And so on the very top of the slide, you'll see a longitudinal design. And essentially, in a longitudinal design, I'm just going to follow the same kids from 2011 to 2015, while the kids are 1 to 5 years of age, and see how their play changes. And one of the nice things about studying the same group of kids is that I can study inter-individual change as well as group changes. So how does child A change from 1 to 2 to 3 to 4 to 5 years of age? And also, how do 1 to 2-year-olds differ, 2-year-olds differ from 4-year-olds, etc. Another design I can use, if you look in the bottom left corner, is the cross-sectional design. And this is where you test different age groups at the same time. So in this case, I'm going to study children aged 1, 2, 3, 4, or 5 years old, but I'm going to test them all in 2011, hopefully. And this is much more efficient than a longitudinal design because I can get all my data collected in 1 year. But one of the drawbacks is that I can't analyze individual change. So I can't see how a child changed from 1 to 2 years of age. I can only study how 1 to 2-year-olds differ on average. Now, a drawback to both longitudinal and cross-sectional designs is something known as cohort effects. And essentially, cohort effects refer to something important going on historically that could impact children's responses. So if you think about when 9/11 occurred, a lot of children suffered as a result of the images that they were seeing on TV, and that there was a lot more anxiety happening in children. And so someone studying, say, personality development or psychosocial adjustment could get some very skewed data as a result of that occurring. And this is what's known as a cohort effect. And if children in your sample are exposed to something, you don't know if this truly is reflecting development normally or if it's more a result of something that happened during that time period. One way to separate this out is to use the sequential design, and that's there in the bottom right corner of the slide. And this is where it's kind of a cross between the longitudinal and cross-sectional design. And in this case, what I'm going to do is I'm going to study one group from 1 to 3 years of age, another group from 2 to 4 years of age, and another group from 3 to 5 years of age between 2011 and 2013. And the way this can reduce cohort effects is that because I'm getting these in different years, I can study, for example, my two-year-olds who are 2 in 2012 versus my 2-year-olds who are 2 in 2013, and see if those children differ at all. And if they do, then that could be due to cohort effects. If they don't, then I can maybe say cohort effects didn't affect my research here. So this is one advantage of the sequential design, and it has the pluses of longitudinal studies. You can study inter-individual change, but it also reduces the amount of time that you need to do that. Okay, so I'm going to conclude the lecture by talking about the importance of ethics and research with children. All children need protection from physical and psychological harm, so when you're designing a study, you want to make sure that all risks are minimized. You need to worry about informed consent. Anyone under the age of 18 needs consent from a parent or guardian to participate in the research, and sometimes you also need that from their teacher if you're going to be studying in a school. And children 7 or older should also provide written assent, and that's because, as you'll be learning later on in the semester, that children are cognitively mature enough to make these decisions at this age. And it's always nice to try and obtain verbal assent from younger children. Let them know what you're doing in terms they can understand and ask them if that's okay. And let them know they can stop at any time. Respecting children's privacy is important, and also letting families know about the results of a study. So my lab always sends a results letter to families who participate in our research to let them know what they found. And finally, beneficial treatments. One of the things that's important is a lot of times there's interventions in research and children get a new teaching style, or a new form of therapy is tried out, or a new drug is tried out to improve the health of children. And if that's found to be successful, you want to try and make that available then to children who are in the control group and didn't get that intervention, so that they can benefit as well. You have a table in your book that nicely summarizes these, and you should become familiar with these more in depth. And I'll leave you with that and see you next time. Thanks.